Welcome back to Health Living. Today, we're embarking on a journey to unravel the mysteries of blood sugar regulation. Get ready to gain a deep understanding of what truly constitutes optimal glucose levels and the intricate mechanisms that influence them. Buckle up and prepare to have your mind blown by the power of science. Conventionally, a fasting blood glucose level between 70 and 100 milligrams per deciliter, mg/dl, is considered normal for healthy individuals. However, in my opinion, we should aim for a tighter range, ideally around 80 to 90 milligrams per deciliter or even lower if you're following a ketogenic or extended fasting lifestyle. This narrower window aligns more closely with our ancestral roots and promotes better metabolic health. When it comes to post-meal blood sugar levels, the traditional guidelines suggest a spike up to 170 to 200 mg/dl as acceptable. However, this wide range is primarily due to the overconsumption of processed carbohydrates and added sugars, which can lead to insulin resistance and a host of metabolic issues over time. I firmly believe that these drastic spikes are not normal or healthy, and we should strive for more controlled levels. The primary factor influencing blood sugar levels is the type of food we consume, particularly carbohydrates. All carbs, whether simple sugars or complex starches, eventually break down into glucose molecules that enter the bloodstream. Simple sugars, like those found in soda and candy, can cause rapid and significant spikes in blood sugar levels, triggering an excessive insulin response. Starches from sources like potatoes, rice, and bread can also elevate blood sugar levels, sometimes even faster than pure glucose. Protein and fat, while having a lesser impact, can still influence blood sugar levels to some extent. Excess protein beyond our body's needs can be converted to glucose, albeit at a slower rate, while a small portion of the glycerol backbone and dietary fats can also contribute to blood sugar levels, albeit minimally. Now let's dive into the heart of blood sugar dysregulation, the vicious cycle of insulin resistance. When we consume foods that rapidly raise blood sugar levels, our bodies respond by producing insulin to shuttle that glucose into our cells. However, over time, if we consistently expose our cells to high levels of insulin, they can become resistant to its effects, leading to even higher blood sugar levels and an increased insulin demand. This cycle is further exacerbated by the consumption of fructose, a component of table sugar and high fructose corn syrup. While glucose can be utilized by all cells in the body, fructose can only be metabolized by the liver, which can become overwhelmed and contribute to fatty liver disease and further insulin resistance. To break free from the shackles of insulin resistance and regain control over blood sugar levels, we need to implement a multifaceted approach that combines dietary changes and lifestyle interventions. One of the most crucial steps is eliminating added sugars from your diet. Cutting out sources like soda, candy, and sweetened beverages is essential for reducing insulin spikes and giving your body a chance to reset. Additionally, it's vital to reduce your overall intake of starchy and processed carbohydrates, which can quickly elevate blood sugar levels and perpetuate the insulin resistance cycle. On the other hand, embracing nutrient-dense, fibrous vegetables like leafy greens, broccoli, and cauliflower can provide valuable nutrients while having a minimal impact on blood sugar levels. These non-starchy veggies should be the foundation of your new, blood sugar-friendly diet. Incorporating periods of intermittent fasting can also help reduce insulin levels and give your body a break from constant glucose processing. Even a daily 16-hour fast can work wonders for restoring insulin sensitivity. In addition to dietary changes, engaging in light exercise like walking or low-intensity cardio can help burn fat for fuel and improve insulin sensitivity without spiking cortisol levels, which can exacerbate blood sugar imbalances. Lastly, prioritizing sleep and stress management through techniques like yoga, meditation, and deep breathing can help regulate hormones and prevent the negative effects of chronic stress on blood sugar levels. It's important to understand that reversing insulin resistance and restoring optimal blood sugar control is a journey, not an overnight fix. While it may have taken years or even decades for this condition to develop, the good news is that with consistent effort and the right strategies, you can begin to see improvements in just a few months. Remember, the key is to ditch the conventional low-fat, high-carb advice and embrace a more holistic approach that addresses the root causes of blood sugar dysregulation. With dedication, perseverance, and a deep understanding of the science behind these processes, You can unlock the path to metabolic health and bid farewell to those pesky blood sugar imbalances once and for all. So there you have it, my fellow health champions. A comprehensive guide to taming your blood sugar levels, backed by science and real-world evidence. Stay tuned for more life-changing insights, and don't forget to subscribe and hit that notification bell to never miss an empowering episode on your journey to optimal health.